I want to thank Brian and Demobant for inviting me to be here today, but also for their partnership along with the Aspen Institute in the research that I'm about to talk about. And no offense, Brian, but even more importantly than thanking you is thanking everyone who is spending this time on this webinar. I realize your time is incredibly valuable. It's always been valuable. It's like even more valuable now. In exchange for that time, I'm going to try to add some value to your work and be helpful in some way. It's important to say at the outset that I am not someone who's trained in public health. I'm not in the public health field. I'm an anthropologist by training. I do a kind of anthropology that's called psychological anthropology, which means that I am deeply fascinated, fixated on the way that culture influences how people think, how people use culture to process information, to make meaning of messages, and to formulate and reach decisions. And so that really is, I'm not just telling you that because I think you think it's important, but that kind of premise, the way that culture in our minds influence how we think and how we feel and what we do, is really the core of what I'm going to be talking about today. So the guiding question in this project that I'm going to be talking with you about today is the idea of, what are the ways that the field of public health can communicate about its worth, about its work, about its worth, to increase the perception of the value of that work and the willingness of other sectors to collaborate. And just so you have a sense of what I mean when I say other sectors, the work that was part of this project was kind of looking specifically at the education sector, at the healthcare sector, at the housing sector, and at the business sector. And so as we begin delving deeply into a presentation on framing, I think it's really important at the outset that we provide some common definition of what we mean when we say framing. So framing is one of these words that I regret to say has become so utterly ubiquitous that I fear it has lost any and all meaning it ever once had. So as an antidote to that, as a remedy, we're going to get together on a definition of what this word means. So when we talk about framing, again, for the next 25 minutes, what we mean is how the choices that we all make, we all, like everybody, makes in how we present information. And sometimes those are like really clear, obvious choices, the values that we use to argue for why an issue is so important and solutions are so paramount. But it's also the seemingly nuanced and maybe insignificant choices that we make. Do we use the pronouns of us and them, or do we talk about we, right? Do we use verbs that imply and extend agency to groups of people, or do we choose verbs that deny or restrict that agency from groups of people? So framing is about how all those choices, both big and small, influence how people think, how they feel, and what they do, right? So kind of understanding emotions and decisions. And so I'm going to make that super concrete here for a second. I'm going to go a little bit outside of the confines of the project that I'm here to talk about. I'm going to talk to you about some work that we've been doing for a very long time in communicating the science of early childhood development, specifically the concept of child mental health, which for most Americans is either not true, right? There's, for a lot of people, the idea that young children can have meaningful states of mental health is invalid. And certainly it is an issue on which public will, public demand, public support for funding, for policies and programs that support child mental health is very low, is very reduced and restricted. So our charge here was to figure out how to frame, right? How to make better choices in presenting information on child mental health to increase people's support for a set of evidence-based policies that come out of the developmental and intervention field that have been shown through solid research to improve children's mental health, to support positive development. Okay, and so this is how the experiment works. This is a large, nationally representative experiment. Was conducted with over 6,000 people, but for the ease of simplicity, I'm just going to say 6,000. And the way that this works is each of these 6,000 people get randomly assigned to read a message. And those messages are what you see along the horizontal axis, the bottom of the screen. So Brian logs on to the online experiment. He gets randomly assigned to read the message of collective progress and kind of social prosperity. So he would read about a child mental health program. It's about 80 words. But then this frame of collective progress and prosperity is at the top. So he would read something like, it's important that we do a better job of supporting children's mental health because, and we wouldn't say it in such a cliched way, children are our future, right? Their stable, positive, healthy development is vital to our ability to progress as a society and be prosperous. Elizabeth logs on, she gets randomly assigned, this is what random assignment looks like in experiments, that's why I'm doing this, to the message of vulnerability, right? So same program description, same 80 words, except the lead-in is different. The frame at the top is different. So instead of what Brian read, Elizabeth is going to read something that sounds like, it's important that we do a better job of supporting children's mental health because children are our most vulnerable citizens. They deserve our empathy and our compassion, and we must do better by them. Then I log on to the experiment and I get randomly assigned to the third condition, which is the treatment condition. So I read nothing. I'm this thin, depressing 0 line that you see across the middle of the screen. And then we all answer the same set of questions that are designed to measure how supportive we are of this set of evidence-based policies. So what you're going to see on the next click are what I think are 2 gorgeous green bars are going to appear on the screen. And what those bars are going to show you is the extent to which hearing those different primes, those different frames at the top, affect people's support for policy. And I have no idea of the statistical acumen of this audience. So here's your quick stats lesson, everything you need to know. Up is good and down is not good, right? So you see 2 bars and you notice 2 things. First of all, that value that Brian received, the collective progress prosperity value, is making people to a statistically significant degree more supportive of those evidence-based policies. That's good news. We have a little framing dance that we do when we get those kind of results. Don't worry, Brian, I'm not going to do it here. But you probably also, let your eyes wander towards the right-hand side of the screen and see this less optimistic performance of the vulnerability value, which, just to be clear, is not only statistically indistinguishable from 0, which is no message, but is actually depressing to a statistically significant degree people's support for those policies. So just to translate that for you, if you're an expert or an advocate working on issues of child mental health and you use the value of vulnerability to frame those messages, you not only waste your breath, but you use your resources in a way that directly disadvantages the issues, the solutions for which you are advocating. And just to be clear, that's not what we want to do with our limited communications assets and resources. So the kicker is that in a subsequent piece of analysis, where we looked at all of the field's external facing materials over a 3-year period, so all of the press releases and websites and social and everything that they put out into the world, guess which value is used in over 90% of those materials, right? And so because of the format of this has to be a rhetorical question, right? It is the value of vulnerability. So in essence, what the field had been doing for a very long time with what in retrospect is a shocking amount of resources, is advancing a value that, again, not only wasted those resources, but worked directly against their goals as experts and advocates. So I want to make the point, kind of bring this back to our current context, to COVID, and the other events that have been kind of dominating our lives for the last 7 months. And just to make the case that framing has always been important, right? I've been doing this for 13 years and it has been important for every single day of those 13 years, but it is super duper important in the world in which we are living right now. And there's a variety, a potpourri of really interesting, or you might say depressing ways that issues are being framed that influence, again, how we think, how we feel and act. And so very early on in the pandemic, so I'm going to show you some of these frames, these unfortunate frames that I've collected over the last 7 months. And the first one comes from very early in the pandemic, where COVID was framed as the quote unquote Chinese virus. And what we see, what we know from a lot of research that's been done, is that choice of information presentation is not inconsequential, right? It leads to some very specific ways that we think about this. It creates a fear of other. It creates a very strong kind of insular nationalism, and it creates a sense of thinking about other groups that wiggles and wanders and attaches to all kinds of in and out group ways that we think about our society. The next one is the now infamous, we've seen a kind of a slight resurgence in this one, I think, this idea of public health measures being recommended as characterized or as framed as draconian in their stance. And I think everyone on this call will understand the reaction here, but I just want to underscore its power in which that kind of framing creates a clear sense that everything that's being recommended is an overreaction, makes people resistant to information, and highly hesitant to act on any recommendations or prescriptions that come from public health. Another one that's kind of more nuanced, but I think potentially more important than these top two, are the ways in which, and specifically related to older adults, the way that information or issues during COVID have been framed around protecting vulnerable populations. And we know from a lot of work that dates back well before COVID that this kind of framing has a real significant and measurable effect in instantly othering those groups that we have labeled as vulnerable, in creating a sense of zero-sum thinking in which any more for them means less for me, and creates this palpable sense of stigma that not only characterizes the way that mainstream culture thinks about groups, but also characterizes the way that affects the way that members of those groups think about themselves and create their identity in some really ugly and pernicious ways. Last but not least, the kind of health inequity messages that have been swirling around. Again, these are true. My analysis here is around the framing, not the validity of the data, but the way in which a lot of these arguments around people of color being infected, dying at higher rates are, without careful framing, tend to be perceived or explained through this idea of certain groups having deficient values or making kind of poor lifestyle or health choices. Again, my use of air quotes there is designed to be plainly and overtly critical of that interpretation. And so all of this kind of boils down or comes together to this metaphor that I've come to use and think is helpful as a way of conceptualizing framing. So I think about framing, again, the choices that we make and how we present information, as this really powerful key that has the ability to unlock people's thinking, to open up new space, to open up new conversations, to allow people to engage with solutions and thinking about their importance in new ways. That's the positive side of the key metaphor. The negative side of the key metaphor, as you just saw, is that in turn, those choices that we make can have the opposite effect, right? They can powerfully shut down thinking, they can close off conversation, they can lead people to reject our messages and to go further and deeper into pre-existing dominant ways of understanding these issues. So all of this work on framing and opening thinking and shifting perspectives stems, unfortunately, from a problem that we all have. So this is a problem that I have. This is a problem that anybody who communicates about anything has, which is, just to be clear, everybody. And the problem looks something like this. It's a communications problem. Don't worry, we're not going to go any deeper or more psychoanalytical than that. Is that I imagine a number of people on this webinar have been in this position before, where you think you have the perfect way of talking about public health, and you try it out with two of your closest colleagues who are also deep experts and practitioners in public health, and it is awesome, right? What could go wrong when it goes out to normal people, right? People who don't live and eat and sleep and breathe public health as you do. And you find that when it does, one of two things happen. So first of all, that message that was so powerful and resonant for you and your colleagues isn't for people who don't do your work, right? It doesn't have resonance, it doesn't have grip, it doesn't have traction, it doesn't cut through, whatever you want to say. It's kind of in one ear and out the other. The second thing that can happen, which is more unfortunate but still frequent, is that message which sends you and your colleagues running towards the importance of robustly funding public health services and research, sends the people you're communicating with in the exact opposite direction. And so I don't want you to take my word for this. I'm going to give you a quick example of what this looks like. We're going to go away from public health to give you some productive analytic distance, and then we'll bring it really close and we'll give you an example from public health. So the first example comes from, again, work that we've done on early childhood, where in the field, people who are developmental scientists and practitioners say things like this. They talk a lot about stress. This is a direct quote, that persistent stress can derail development and have negative long-term effects on health and well-being. So I said this was a direct quote. I've made one editorial change on this slide. In the original quote, negative was deleterious. but I've made that edit to be mildly less obvious and obnoxious in the point that I'm about to make. But for people who work in the field, this is like true, really true, truthity true, straight through true, lots of research, number of disciplines over a long period of time, which shows this to be the case. But unfortunately, for people who are not in the field, people who are not trained or practiced developmentalists, this kind of message elicits things that look and sound like this.
Life's hard. It's supposed to be hard. You know, what doesn't kill you makes you stronger. You know, all the bad cliches you can think of. I mean, there's been people that have come from absolutely nothing to make it in whatever society's eyes deems success.
So I hope you could all hear that. I realize it's a little hard to hear. The audio is kind of bad over the street noise in Tucson, Arizona, which is where this gentleman is being interviewed. But just to be crystal clear, that which you just heard, what doesn't kill you makes you stronger, is not what this expert intended when he or she opened his or her mouth to deliver this message. So there's something going on between the intention, the delivery of the message, and its actual effect, its reception. Right? And I'm going to leave you on the edge of your seats wondering what that is for one more second as we go closer to home and show you what this looks like in the work that we've done on public health. So people who work in public health say things like this: public health engages a network of professionals that uses evidence to promote living and working conditions in which all communities have the opportunity to be healthy, right? This sounds like something that I imagine some of you maybe have said. This might be a direct quote from somebody who might be on this call. I have no idea. But for people who work in those other sectors, education or housing or business or even healthcare, the way that this message gets processed, the effect that this message has, is something that looks and sounds like this.
If I were to ask you what is public health, how do you think you would answer that question?
It's not an easy question to answer.
A lot of doctors have masters in public health, but I'm not sure what it entails.
If you work in the public health profession, aren't you concerned with policy or something?
When I think of public health, the first thing that comes to mind is health care for the poor.
Dealing with the health care needs of the indigent.
Certain facilities that are operated and funded by the government.
When I think of public health, I think about the CDC.
I think, first of all, the CDC and then the local Department of Health.
I think of the CDC. They kind of inform the masses.
Educated people about the different viruses and things they can catch if they don't protect themselves.
Identifying patterns so that certain things don't happen, outbreaks.
Like infectious diseases, and if the produce is tainted, then, you know, the public needs to be informed.
So that one I think is a little less dramatic, hopefully, than the one about what doesn't kill you makes you stronger. But it is clear, and I just want to make this clear in case anyone had difficulties hearing the audio, that what you heard on the right-hand side of the screen, while it may not be incorrect, is certainly incredibly partial in its understanding. It does not encompass the breadth of understanding that this expert intended when he or she is communicating this message on the left-hand side of the screen. So what is it that explains these differences, this gulf between the things that we say and the effect that our messages have? And it is this little thing called culture, right? And I don't mean culture in the kind of Indiana Jones external artifact kind of culture, but rather culture in mind. Culture as a shared set of patterns of reasoning, of understandings, of assumptions, of propositions, of ways that we understand the world and that we use to make sense of the information that we are presented with. And so a good amount of the work that we've done with Brian and colleagues at Beaumont and Aspen was digging into this deceptively simple green bubble of culture and figuring out what are the pre-existing understandings, the deep kind of cultural models that inform people's thinking about public health. And that information, I'm gonna not go through that here, but is available in reports that exist on the Beaumont website as well as on the Frameworks website. But the interesting thing, or the important thing about understanding culture, is that when we understand culture, we get an incredibly crisp view of the framing challenges that exist on an issue. So understanding what's in that green bubble of culture when it comes to public health and how people in those sectors think about it, sent us clearly towards a set of 4 challenges that exist on the issue. I'm not going to go through these in any great detail. I'm going to take one of them and I'm going to use it as an example to talk about how a challenge can be addressed through the use of frames. And the one that I'm going to take here is the third one here. But I want to first make the point that, again, there are materials available where we have addressed each of these 4 challenges through a number of framing strategies that, that can effectively be leveraged to bridge that gulf between the things that you say and the way that they are heard, processed, and understood and used by the folks you are communicating with. But again, we're just going to take the third one here, which is the challenge. And I think this is true. So this is kind of set up in Brian's introduction. It's also evidenced to a degree by the findings that Elizabeth presented, is that there is a challenge around kind of the thinness of people's understanding of public health, what it does, what it brings, what it offers. And so this challenge is really the need to deepen people's senses of the field, what it is, what it does, what it brings, kind of skills and expertise. And on this particular challenge, we deployed a set of framing strategies. The one that emerged as most effective in our research was metaphor, right? And metaphor is an incredibly powerful framing device. And what metaphors do is that they help do that deepening, right? They have this incredibly fast, efficient way of expanding our thinking, of creating new ways for us to see issues, engage with them, talk about them, and see the importance of solutions. And a great example of that is, again, pulling from our work on early childhood as an example, the work that we've done in the field over the last almost 20 years now, in which you take something very familiar, the process of building a structure, a house, a building, and you compare it to something highly unfamiliar through the metaphor, which people may have heard about, called brain architecture, right? So this is what we call an explanatory metaphor. It allows people to think about the thing that is unfamiliar by recruiting some of their understandings of what is familiar. And what happens when this metaphor is cued again and again and again is that it starts to get people thinking about brain development in some different ways. So if brains are built like a house, then there's a set of things that I can understand and that kind of fall into place in my thinking. Well, first of all, it means that what happens early really matters. It means that those materials and ingredients that are used in development are not inconsequential early, but they are of foundational importance. The timing matters, the activeness of the process is significant, and most importantly, that what happens early when we are laying the foundation and completing some of those early operations affects everything that gets built on top and that happens later. And so what happens when these propositions start falling in place, and as we've seen over the last 20 years, is that the policy discussion shifts foundationally, right? And it begins to focus on solutions that with previous understandings did not make sense, that now suddenly do. So to address this third challenge, again, deepening people's sense of the value of public health, the expertise and the skills that the public health field brings to problems, we tested a number of different metaphors. The one that emerged as most effective across that testing was the idea of navigation or a GPS system. So the metaphor you can see it on your screen on the left-hand side of the screen. It's kind of talks about the power of GPS and helping us navigate complex terrain, and kind of takes that and connects it squarely to what public health professionals do, explains that they draw on data to chart a route. You can see the metaphor there as well, of where we are to where we want to be, and the importance of using data to help us all move towards solutions. And I would argue that this metaphor, if anything, has become monumentally more important to use in the current context, as Brian said at the beginning. So in our testing, what we found is this metaphor consistently builds awareness. It shifts people's thinking about the value and breadth of public health. It fosters understanding of the problem-solving nature of it, and it creates a really palpable, vivid illustration of the way that public health data and professionals and skills can be kind of harnessed towards moving in better directions. The importance here, I think, and these are some of my last points, is that these framing strategies, this metaphor and the other strategies that I threw up on the right-hand side of the screen, are really only effective if we can use them all together. And so this is, I'm not going to characterize the field of public health in this way, but this is certainly the way that most of the fields in which frameworks works tend to look, right? And so they look like this. I'll take education for an example, right? You've got the people who are doing higher education, K through 12, pre-K, educational disparities, school discipline. They're all talking in a million different ways. And what do you think this does in terms of changing people's thinking, of shifting what is in that deceptively simple green bubble of culture? The answer is it does not do a lot. And so the move that we have to make is towards something that looks less like what we see on the left-hand side of the screen and more like what we see on the right-hand side of the screen.